Health insurers have been exploring vertical integration strategies, that is, consolidating services and companies across the healthcare value chain. The pandemic has only sped up these efforts. Here to discuss a new report on the subject are AM Best Senior Director Sally Rosen and Associate Director Bridget Maehr. And Bridget, let's start with you. What advantages are companies realizing from vertical integration?
Advantages are better coordination of care to identify gaps and to improve patient outcomes. The coordination of care also helps to provide care in appropriate settings, which can improve cost and quality. Vertical integration strategies also offer health insurers diversification of both revenues and earnings, and also a source of non regulated cash flows.
Sally, the report notes that one size does not fit all when it comes to integrated strategies. Why is that?
Well, there's a couple of reasons. First of all, not every insurer would like to own the vertical integration approach. Some are starting with a partnership or a joint venture approach as opposed to an ownership. And they find that the joint venture or the partnership approach can still provide the benefits that Bridget discussed. Additionally, we've seen a varied approach to the ownership of provider services and other integrated strategies. And it's really based on the needs of the insurer and their population and whether a specific type of vertical integrated strategy makes sense for them. An example of this is an insurer that is more focused on the commercial or employer and individual market may have less interest in owning home healthcare capabilities than a Medicare Advantage insurer who is focused more on the senior population who would have a greater interest given the aging population.
Bridget, is there any concern with the heavier M&A activity in this space?
Yes, concern has actually increased over the past few years. Previously, M&A in a vertical integration fashion was viewed fairly benign to competition and sometimes even favorable to cost across the system. However, over the past year, there has been more scrutiny following an executive order that was signed by President Biden to increase enforcement of antitrust and anti-monopolization laws. In fact, earlier this year, the Department of Justice filed suit to block the pending merger between United Healthcare's Optum Insight and Change Healthcare, alleging that the transaction would harm competition and also impact the technology used by health insurers to process claims and to manage cost.
So we're 2 years on now living with COVID. Sally, do you expect telehealth to keep growing?
There's a lot of interest in virtual or telehealth visits, although I would note that telehealth visits are down from the peak in the spring of 2020 when the provider system essentially shut down with the start of COVID. But individuals like the convenience. They can get care at all hours of the day. And it's also found to be beneficial in certain situations, such as behavioral health. Health insurers are working around certain issues. Some states have mandated paying at parity, which is paying the same as an office visit. And there had been some waiver of telehealth or treatment across state lines, which were waived during COVID. And some states are still waiving it and others are not. But we would also note that some health insurers are designing what they refer to as a virtual first plan design for non-urgent visits. And these plan designs typically have lower premiums and or copays and designed for individuals who are interested in the convenience that virtual care can offer. These virtual provider plans and will refer the patient for an in-person visit, lab work, et cetera, if necessary. So there's definitely growing interest, and we do expect to see continued interest in telehealth.
That was AM Best Senior Director Sally Rosen and Associate Director Bridget Maehr. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.